Hello, everyone, and welcome to our second CPAN Advocacy Chat. For those of you that joined us last month for our first Advocacy Chat, thank you for returning. And for everybody who's joined us and giving us 30 minutes of your time today, thank you so much for being with us. I'm really excited to have as a special guest today someone that many of you may know, Patricia Goldsmith, who many people know as Trish, is the CEO of CancerCare, and she's someone that I've known for over a decade, meeting her in my very early years of advocacy. And what I've learned is when I first met Trish, just like many people, it's easy to be intimidated getting to know someone who's a CEO of an organization that's been around for 76 years. But as you get to know Trish and you listen to her today, you're going to be just as interested and captivated by her personal story as I've been. That's a little bit about how I feel about Trish personally. Professionally, we're also COA and Community Oncology Alliance and CPAN, Community Oncology Alliance Patient Advocacy Network. We're very proud of several partnerships that we've had with Trish and CancerCare over the last several years, going back to our work with Puerto Rico during the hurricane and a lot of our patient initiatives right now with COVID. So I would like to welcome Trish Goldsmith, CEO of CancerCare, as our guest today. Trish, nice to see you.
Rose, thank you. It's always a pleasure to see you. It's a pleasure to work with you and your colleagues at COA and to participate in this important webinar to talk a bit about CancerCare as an organization, and then really to share with you many of the things that we are doing in response to COVID-19, which obviously has had a massive impact on all of us organizationally, personally, and of course, from the perspective of cancer patients and their loved ones, the impact is huge. So for those of you that don't know a lot about CancerCare, let me briefly say we are a 76-year-old organization that is based in Manhattan with offices also in Long Island and New Jersey. And the organization is really about serving and providing help and hope to anyone that has been impacted by a diagnosis of cancer. So of course, that can be any type of cancer. It can be the individual that's been diagnosed themselves, the caregiver, the loved one, the bereaved. We are here to support anyone. I want to say that everything that I share with you today is provided free of charge to anyone who reaches out to us. So the organization has three fundamental pillars, and that really is the psychosocial support, education, and financial assistance. And that has been a cornerstone of the organization since the very beginning. So although the organization has grown and changed, and we've always remained true to our mission. With rare exception, when anyone that reaches out to CancerCare calls us, the phone will be answered by a master's prepared oncology social worker. We actually have over 40 full-time master's prepared oncology social workers that are the first point of contact for anyone reaching out to the organization. Today, I would say that about 80% of individuals that are reaching out to us are seeking some form of financial assistance. But what I think we all know is rarely is it just a check that will resolve what may be going on with that particular individual. So the social workers, using a very sophisticated system that we have built called Connections, are able to do an intake and understand what is going on with that individual, their diagnosis, the family dynamic, potentially the employment dynamic, and then match them with a laundry list of services that we can provide, whether that be financial assistance, counseling. We do counseling one-on-one. Of course, like I think most every other organization, given the COVID, we are no longer providing services in person, but we are providing individual counseling either via the telephone or through a mechanism like this, group counseling that's online or via the phone, support groups, etc. In addition, we have a robust set of education programs that are staffed by many of the KOLs across the country. I'm pleased to say that typically we conduct 75 education sessions per year, sometimes a bit more, sometimes a bit less. Many of them are disease specific. Others are focusing on understanding the Affordable Care Act, symptoms and side effects, wills, powers of attorney, etc. Very practical information. And in all circumstances, those KOLs, many of whom I've worked with during my time at NCCN, volunteer their time freely to provide this valuable education. So there's many other programs that CancerCare provides, community programs, free wigs, breast prosthesis, back to school programs, holiday programs, but we really are always known for those three pillars of psychosocial support, education, and financial assistance.
Trish, great, great introduction about your main areas of providing services. I want to go back to something you said earlier, because I think it also sets the tone for your organization. You were talking about the beginning of CancerCare. What a lot of people don't know is your personal story. In addition to being the CEO of CancerCare and really being in direct contact with so many patients and survivors, can you share a little snapshot of your own experience and how that drives your leadership within the organization?
I certainly can. Thank you for asking, Rose. And this is something that I have been very public about. And so 10 days before starting and assuming this role at CancerCare, I was out of the blue diagnosed with colorectal cancer. For the last 6 years, I have been dual residence, living up in the New York City area during the week, and then often returning in my home in Bucks County, PA. So my intent was get all of my appointments done, including that routine colonoscopy. And literally 10 days before I started at the organization, I got the call that no one wants to get, and that is that you have cancer. And I will tell you that I've often heard people say, when you hear those words, everything stops.
Mhm.
It is absolutely true. And I am obviously not the average individual with respect to knowledge of cancer, base of knowledge and connections. What I'll tell you is that it was incredibly difficult to navigate through my treatment choices and options that included a combination of surgery, chemotherapy, and radiation therapy. And I had the best support system and contacts at Memorial Sloan Kettering, Johns Hopkins, and others. But it still was very, very difficult. I wasn't afraid that I was going to die, but what I was afraid of was, what will I say to my trustees? Gee, I just am assuming this position, and oh, by the way, I have cancer and I'm going to have to take time off for surgery. What would I tell the staff who had, quite frankly, the organization had been leaderless? What I will tell you, and I know this sounds insane, is it was really a gift to me. It made me have a profound and deep understanding of the complexities of being diagnosed, of what it takes to navigate through the system, and also to really have a great appreciation for what our organization does. So it's had a happy ending. I will say that, I am gratefully now on yearly surveillance, and it is time for my surveillance colonoscopy. And even I hesitated momentarily
Yes.
about scheduling it and the fear of going into the hospital setting and COVID. So I know that's a real issue for individuals, probably another topic for another time, about taking advantage of screening that needs to be done.
And thank you, Trish, for sharing that part of your story and your leadership journey as well. And you're right, and also for sharing about your screen exam. Many people also participated in our virtual conference and our virtual advocacy summit. And like what happens with many of us after we do an event, we start getting lots of emails. And a piece of education that many of our listeners took from the virtual summit and from COA's conference was they really listened to the COA physicians reminding everyone that we all need to get back in for our screening exams, because just like the COA oncologist, a lot of the primary care providers and other specialists, they're very, very aware of the need to maintain patient safety. So we do have to get back into that. So Trish, you talked a lot about how you knew how to take care of yourself, but even so, it was really challenging. So something that I have always found very unique about your organization, and I referred many cancer survivors to your organization, is that you have such a vast array of services. You touched on the major three, but something that I would like you to talk a little bit more about is a lot of the online materials, there are podcasts. Like, for example, when I was preparing for this call, I took a fresh look at your website and I saw your Voices of Cancer podcast, which I believe was the title. And there are a series of 10-minute vignettes. Most of the ones I listened to were 10 minutes. There was one for talking to children, during COVID, caregiver issues. And I think what happens, at least for, I can only talk about my experience, and just like you, Trish, I've talked to a lot of survivors over the years. Everybody processes differently. Some people don't want to see a social worker in person. It's too personal. Maybe they live in a small town. So I like the fact that a lot of your services are done online, and this was pre-COVID. So can you expand a little bit more on, you did mention that with COVID, a lot of stuff that was live is now virtual, but I really wanted to focus on how your organization was really in the lead, doing a lot of things online pre-COVID.
Sure. Rose, I'll talk about that. And then that's a nice transition and segue into what we're doing in the COVID space. I'm very proud of how our organization has reacted, the programs that we've built, and especially programs that we've built with you, which I will speak about. One thing that we have learned as an organization, and we typically directly serve anywhere between 175,000 and 200,000 individuals across the country every year. You have to meet people where they are. You can't just have one modality. There are individuals that, quite frankly, don't have internet access or don't necessarily feel all that comfortable being or internet savvy. There are those that still prefer the telephone. There are individuals that prefer those short podcasts of 10 minutes. Others that like the Connect Education workshop, others that want fact sheets, brochures, etc. And so we learned a long time ago that it's important to meet individuals where they are. And boy, oh boy, has that really been the case with respect to COVID. So, I'd like to talk about that and segue into what we've done. And, when I joined CancerCare 6 years ago, literally, you can look out the windows of my office and you can, of course, see now the new Freedom Tower. It's a gorgeous view, and we have many employees that were at CancerCare in those very offices when 9/11 occurred. And I heard about the challenges of individuals walking 3 or 4 hours a day to get to and from the office. And I realized, quite frankly, that our technology was antiquated. We had a lot of hamsters on the payroll. We had a lot of paper clips and rubber bands. Thank God we hired a phenomenal chief information officer who invested in technology and the ability 2 years ago to selectively have individuals work remote. I am pleased to say that in a matter of 2 days, we were able to close all of our offices down and take everything remote other than fitting wigs and breast prosthesis. We're now fitting wigs electronically. And that has just been, pandemic wasn't even in our vocabulary, but it's been a blessing to be able to do that. And the extraordinary demand for our services, just as an example, in the month of April, we fielded over 9,000 calls just to our Hope line. That was a 41% increase. We're seeing anywhere between 25 and 40% increases in our volume of services. We actually hired 4 social workers. And then what we realized is that we had to make sure that we could get credible information out to individuals very quickly. Thus, the fact sheets on understanding COVID, speaking to your children about COVID, the podcast series, the Connect Education workshops, all of those had to happen very quickly. In addition, we needed to really figure out how we were going to meet the exquisite demand for financial assistance. A hallmark of our organization is the 2 buckets of financial assistance, the co-payment foundation, and then the financial assistance that provides for babysitting, transportation, pain medication, lymphedema sleeves, etc. The demand has always been high, but this was exquisite. So we set about doing, for CancerCare, creating a financial assistance program that provided $500 grants to individuals in active treatment to help them with transportation, groceries, etc. I have to say, If you ever had, if you've ever wondered or felt sorry for yourself, you just hear the calls and the level of desperation. A woman who called, who single parent, 3 children, one slice of American cheese in her home, and a well that was polluted and no money to even have water. And she's in active cancer treatment. So we raised to date over $4 million in financial assistance and transportation assistance. I will say that with the exception of the transportation program, which I really want to talk about, most of that financial assistance is no longer available. Essentially, it's been expended. We partnered with a wonderful organization, Longevity, that we've worked with to open financial assistance funds for lung cancer patients. Those are still available gratefully. But one of the programs that I am most pleased about is early on in the COVID, Ted, the head of COA, reached out and said, Trish, we've got a problem. And we had the experience of working together in Puerto Rico to create transportation programs and financial assistance programs. We did a phenomenal thing getting the medications from the port to the physician's offices. So Ted and I put our heads together and we recognized that there was a massive issue in community oncology with respect to individuals not going to treatment because either they didn't have anybody to take them, they couldn't afford gasoline, mass transit was closed down, they were afraid because of being immune compromised. We needed to do something. Fast forward, CancerCare contracted with 2 national transportation companies to provide medically safe transportation, meaning mask, gloves, the cars are sanitized. We worked with COA. COA enrolled 110 practices across the country, gave them PIN numbers, and enabled the practices to order the transportation round trip for their patients. I will also tell you, and I cannot give enough credit to Bristol Myers Squibb, who stepped up with the initial grant of $1 million to fund this transportation program. And I'm pleased to say just last week, Bristol Myers Squibb provided another $500,000 for this program. We've raised $2 million for this program. And to date, we've transported over 8,000 patients to and from treatment, patients that couldn't have gotten there otherwise. That's where collaborations and novel programs are so critical in making a difference. And, we just have a track record of doing that with COA. And this is a program that I'm just so proud of. And it shows when, there's a need and you really set your mind to it, you can do creative things to help patients.
Trish, thank you. And something that I want to say about the collaboration, that another way that your organization is distinct among other organizations is that you also help us by sharing the stories about our own cancer survivors and COA's own programs. And you mentioned that we do have cancer centers across the United States. And that's one of our very important educational points within COA is we are the organization that represents the majority of cancer patients across the United States. In your own situation, for example, you mentioned you were treated at 2 academic centers, and those are fabulous hospitals. We know that. And most patients are treated in multiple settings. But our membership is vast. And what that means is that we are bringing these services, not only of our organization, but your organization, to cancer patients all across the country. And I want to just go back to some of your comments about the needs of patients. So I know that cancer now, unfortunately, is so common that it's easy for family members, caregivers, friends to minimize the impact. And they think, oh, you're going to have chemo and radiation, it's going to be over. But there's so many more needs that patients have, not just during COVID, but when you talk about, a parent being at home without an income and no food in the refrigerator, those are tragic situations. There's so much, and I hope for all of us, we can always remember never to minimize the experience of a cancer patient. You mentioned that when you were going through your own treatment, you were not, you were able to navigate somewhat more than most people, as I was. I wasn't concerned about bases like food and housing. But when an organization like yours talks freely about these things, it reminds all of us that patients have so many needs, from the social workers to literally food and a right to get cancer treatment. So thank you again for pointing that out.
Sure. And Rose, I mean, I never had the depth of appreciation that I do now for what a 200 or a $500 check can mean to an individual. I mean, the
Oh,
letters that we get are just, I mean, it's extraordinary. You fed my children. You allowed me to continue with my treatment. You know, not only did I get a check, but I was able to get transportation where I felt safe. We have in Pennsylvania actually a mother and a daughter who are both in active treatment that are using the transportation to get to a practice. It's a beautiful, beautiful story. And so I think, you know, never underestimate the power of what those dollars can mean to individuals.
right. And I love the fact that when the transportation fund first opened, it was definitely not another Uber. You know, you think about a car being sanitized. I mean, now we want that to happen for all vehicles, but that really is powerful, Trish. So you've mentioned a lot of programs. So put yourself now in the position of someone in our audience and they want to go to your website, they're taking notes, they want to try to find things. How do you direct them to navigate your site? Because you do have, you know, key areas, financial section, case management. What is your recommendation when someone's visiting your site? How do they navigate that?
So I'm proud of how easy it is to navigate the site because it really does kind of direct you to this is for caregivers, this is for patients, learn more about financial assistance, more about education, and then from there are landing pages that individuals can go to. As an example, right now the two most heavily trafficked sites are parts of our website are the financial assistance and COVID-19. We have a dedicated page on our website that is available, that has a repository of all of the things that we have done with respect to COVID-19, education, fact sheets, information, etc. And then, of course, I always encourage folks that need help or information to reach out to our toll-free Hope line. You won't get a recording. You will get a master's prepared social worker that will answer the phone and in a very, very caring way, do their best to provide credible information and get practical support to you right away.
And that's a very important nugget. So if you call, you're going to get a live human. So be prepared, because I know whenever I call a business and a human answers, I'm startled. So, you know, be prepared with what you're going to get a real person right away. So Trish, you know, cancer staff employees, your social workers, how are they describing their experience of dealing with patients right now? They have their own needs that need to be met. So what is your staff doing? You know, what advice do you have for people that are not just, you know, patients, but the caregivers, the family members, as they navigate through COVID and just a cancer diagnosis in general? What kind of insight are you hearing from your social workers?
So I'm glad you asked that, Rose, because it has been a real concern of mine. And, you know, our Chief Operating Officer, Christine Verini, and I talk about it very often because it isn't just the volume of calls that we're getting, it's the intensity. These are not calls of, gee, I'm not exactly sure where to go to get a low-cost mammogram. These are very intense and very difficult calls. So what we've done, first of all, I do think that by virtue of the fact that we closed early and said to our staff, your safety, of course, when we closed, Manhattan and New York was the hotbed of COVID. We closed early. We've told people, our staff, that you're not going to have to come back to the office. We're not even going to talk about it until after the first of the year. We've hired people. We've not laid anyone off. There's a lot of loyalty and gratitude there. And there's also the recognition, as difficult as it is, that every day they can make a difference in the lives of hundreds of people that are calling. But we do try and do, you know, some kind of Zoom features and chats after hours. We try and do work very hard I try on generally on a weekly basis to send an update to the staff talking about accomplishments, future programs, thanking them. Our trustees have been amazing in terms of thanking them. Every single staff member got a box of gourmet brownies from a bakery in New York City, thanks to one of our trustees. And I think that it's just really, you know, knowing that you can make a difference, that you have an employer that cares about you. But it is worrisome because these are intense, heart-wrenching calls.
Right. I know during my own diagnosis, I was very, very private, but I eventually, at my oncologist recommendation, went and spoke with a oncology social worker, and it was really life-changing. So I have the highest respect for the social workers and of course nurses and everyone on the medical team. But there's a lot of truth that when you go to a safe spot, which oncology social workers make you feel, you're gonna release a lot of stress just by knowing that to be in that profession where listening is truly what you're being paid for and you're there knowing what you're getting into, it's a true gift. And I think all of us right now, we're looking for those positive stories, which you've shared a lot of today, Trish. Our time is, going really fast. This is kind of advanced advocacy, but hopefully the goal for today is that people can take away some information and learn from you with all the great resources that you have. And I also want to remind everybody to also visit COA's website, communityoncology.org, and our advocacy website with the address listed below. And before we get ready to wrap up, Trish, I wanted to ask you if you had any other information you'd like to share, whether it's personal, professional, fun, anything that you would like for our audience to know.
Oh gosh, Rose, I think for me, my staff always laughs. I'm always the cup is half full. I really look for the silver linings in things. And I think for me, the silver linings have been to see what a remarkable group of people we have at CancerCare, that we have really been able to step up and meet and exceed the demand. Silver linings in adversity has brought some of the best partnerships, including this wonderful relationship with COA, which is only going to get richer, but that could be another topic for another time. And so it's really, really silver linings. And, I think from a personal perspective, I am extraordinarily grateful to lead an organization that I think makes a difference every day and that I believe in. And Rose, I'd like to say, well, certainly our website is up there. I'm happy if anyone would like to contact me. My email is very simple. It's pgoldsmith altogether at cancercarealtogether.org. Happy to hear from you, help as I can. I will say that I often joke with my staff, help, I'm drowning in email and I can't get out. But, I think that's the norm today. And so I'm just very, very grateful to have been, spend time with you and to have shared CancerCare's story today.
Well, we're definitely going to be in touch, Trish, and I'm going to go to our next slide. And I want to thank you again for giving us so much information and sharing your personal story and reminding us about your great location, New York, which I did have the opportunity to visit. Christine gave me a wonderful tour. And something that I remember very clearly from going to your office in Manhattan was I was ecstatic that you had print copies. There was publications of basically everything that you do. And I said, yes, this is what people need, because as I've gone around the country, there's patients and survivors that they really want things in different ways. Some people want it, as you said, on via email, and some people really want to have a brochure mailed to them. So you really stepped up on that. Thank you so much, all of our attendees. And Trish, again, thank you for your time. And I want to thank our communications team for doing all the behind the scenes work. And next, please join us next month where I'll be talking to Dr. Barbara McEnany. And this is a subject I'm guessing many people don't know about, just because it's just not something that's, in the advocacy space very often. And it has to do with white bagging and brown bagging. It's not about purses and it's not about lunches. So I hope you can tune in and you'll enjoy hearing from Dr. Barbara McEnany. Thank you all so much and enjoy the rest of your day.